coffees today, shouldn't I? Let me know when you're good to go. Well, it's wonderful to be here with students from the Deadly Start school-based traineeship program. I've just joined 45 new students that will be studying part of their health studies through their school-based traineeship and partnering with the Metro North Hospital and Health Service. We train about 100 traineeships a year. From the start of next year, we will be tripling that and bringing on 300 school-based traineeships each and every year into Queensland. We know we need to grow our health workforce, and the best way to do that is to be working with our schools and finding young people who are interested in a career in health early on. We're also partnering with universities so that those who want to go on to study clinical or scientific studies will be able to be supported through those pathways. We've also got nurse traineeships happening as part of our programs in Mackay as well, called Big Dreams, Small Steps. And this is a 52 school-based trainees, or 9 Aboriginal and Torres Strait Island students already doing that nursing school, but another 52 school-based trainees across schools in southeast Queensland here as well. So I have with me today students who have completed the traineeship and are now studying nursing, and also students who are nearing completion, and including from Redcliffe Hospital, my local community, who are looking at careers in health as well, and I'm keen to give them an opportunity to talk as well. These are Cert 2 and Cert 3 qualifications, so the traineeships that we're delivering is in health support services, allied health assistance, dental assistance and business administration. But what we do know is many of these students are then going on to choose other pathways, including nursing, which is really exciting. We've just heard some great news as well, because the board chair in Metro North has just advised all 45 students in the current enrolment that they will be offered employment going forward when they finish their qualification. So they've got their first foot in the door to a health career, whether it's with Queensland Health or more broadly in disability, aged care or primary or allied health care. We know that helping grow our workforce here in Queensland will set us up for the future. When we talk about putting on 2,509 new beds over the next 6 years, well, we're going to need the workforce to make sure we can make those beds operational, and that's what this announcement today does. So I might hand over to our 3 students who can tell you a little bit about themselves and what they're studying and what their career hopes are. Kaisha, do you want to go first?
Do I have to?
How about you just tell us your name and what you're doing?
Okay. My name is Kaisha Payton. I am studying nursing right now at ACU. I did this Deadly Start traineeship. I finished last year, June, and the traineeship really set me up to get me into the pathway I really wanted to go. So I'm doing nursing now, and I'm really grateful that I did this traineeship.
What was it like studying during the pandemic?
It was sort of. I mean, I got the job done. We really, I don't know what to say.
Was it a tough time?
A little bit,
Did
yeah.
it make you really want to do it? Reinforce the reasons why you've chosen that application?
Yeah, I think so, because we do need more workers, especially Aboriginal workers. Yeah.
That's fine. Thank you.
Sorry, I don't know.
Oh, good. Thank you, Kaisha. Zakron, do you want to say a few words?
Yeah. Hi, I'm Zakron. I'm a proud Kamilaroi and Kalkadoon man, and I'm nearing the end of completion of my traineeship, and hopefully looking to go on and seek further education next year. It's been a really good opportunity, as last year I only got brought into traineeship, which has broadened my education experience a lot, whereas in grade 10, which I'm now in grade 12 now, I was looking to go into a trade, hopefully be working as an electrician, but now I'm working in the healthcare system, helping people, saving lives, and really bettering the outcome of health for my people, and the students leading forward into this traineeship, giving them an opportunity and good mentorship and guidance in the future.
Okay.
Hi, my name's Ty. I'm a proud Gunganji man from just outside of Cairns. So I've been working in the ED on my at the Royal in the ED for my traineeship. I've loved all the staff down there, very inviting, welcoming, and just seeing the variety of patients that are coming into our department. The workload's been great, and just connecting as a community, I guess, bringing everyone together and trying to solve and bettering the outcome for those patients that are coming into the emergency department.
Thank you so much. And Zachron's just told me that he's interested in going off to the army and being a medic as well. So, but then coming back and hopefully working in our health system. But it just shows that our commitment to health equity for our Aboriginal and Torres Strait Islander people is not just about good outcomes for healthcare, but it's actually making sure that we've got Aboriginal and Torres Strait Islander people working in our healthcare system, delivering on those commitments. You know, we talk about closing the gap, but we need to make it clear that these are not just targets and statistics, they're people, and we need to put them into real action to make sure that we're getting great outcomes. So I'm very proud of this program. I'm thrilled that this program is expanding year on year. I'm thrilled that these students are going to be offered placements in the hospital and health service, and the fact that we're going to triple the number of traineeships from next year means we're going to have a much larger workforce to prepare for that growth that we know that we need for the future. Other questions?
Well, Minister, the Together Union says that it's a struggle to find health staff. Do you admit that it could be hard to not only retain the ones that you have, but find new staff?
It is, and what we know is that there are a lot of graduates out there, and there's certainly a lot of school students out there that we could be tapping into for these traineeships. Everyone wants qualified people up front. My hospitals want me to find fully qualified nurses right now. But to get fully qualified nurses, we need to get more graduates in the door, and we need to be engaging with school-based traineeships so that we can grow our own. And we need to find the better ways to do that. We need to find ways that we can ensure that we can partner with the schools, we can partner with the colleges, and we can get these graduates in and train them up. Because what the pandemic has shown us is we're too reliant on overseas imports. We will always have international staff that will supplement our workforce, but if we can grow our own primary and allied healthcare staff, our physiotherapists, our psychologists, our nurses, our doctors, it sets us up so much more for the future, because we do have a shortage across this country right now.
What percentage of the 9,500 new health workers that you've promised to deliver, what's the percentage you think will have to come from overseas?
Well, it's hard to say at the moment. I am pleased that we've got more nurses and doctors coming from overseas in the next couple of months. That will help with the immediate pressures, but in the longer term I want to see us less reliant on that. So, you know, the 9,475 extra staff we've committed to in this term of government, they are permanent workers. So whether they're from overseas or whether they're here domestically, it is still a permanent workforce. But if we can ensure that our permanent workforce comes more from people who are here in Queensland, studying in Queensland, we know that's better. When I go around and meet students from Central Queensland University and JCU, for example, who are studying in the regions, they want to work in the regions. So we know if we study, if they live, if they work, if they study in the regions, we're much more likely to get them to want to go work in our regional and remote communities, and that's what we're concentrating on at the moment. So we've seen a very significant jump in the last 7 days of the number of beds of COVID patients. We are in a third wave. I am concerned that this new wave may see us peak higher than what the second wave did. We seem to be seeing a pattern where every 3 months we're hitting that peak of a new wave. That is not a very long time. In fact, we probably hit our lowest mark of just under 300 beds for COVID patients for only a couple of days before it started turning around again. So what this says is that the vaccines are still really important, that those people who are eligible for boosters, including the 4th booster for people who are 65 plus, and this was a conversation the Chief Health Officer had with me this week. He is concerned, particularly people with 65 plus, who are due for a 4th booster. We're seeing too many people in hospital, and the risk is still there. We know BA4 and 5 is increasing in the community. People who have had COVID before should not assume they won't get it again. If people start getting flu-like symptoms, they should be still testing themselves for COVID, as well as checking whether they have influenza A. And we are seeing an increase in people having both. So please go get your COVID vaccination, and also reminding people that that free flu shot ends on the 30th of June, and people should go out and get their flu shot straight away. Well, my concern is that if I was to stand here today and say we're extending it, people will see that as a reason to not go out and get the vaccine now. The fact is, we have not hit the peak of the flu season. Well, we're not sure if we have. We certainly haven't hit the middle of winter yet. We're only at the end of June. So we don't want people putting it off any longer. There is plenty of vaccine to go around. There are community pharmacies and GPs right across the state that can provide the flu vaccine. I want people to come out in the next 2 days and get that shot, including for their children, because we're seeing a lot of young people and children in hospital wards with upper respiratory conditions because of the flu right now.
A couple of weeks ago, Queensland Health announced that it was rolling out testing facilities so you could test for COVID and the flu, and I think RSV. Has that now commenced?
Yeah, so we've not only when we're doing our own testing, that our doctors should be testing for both flu and COVID, but we've also communicated that with GPs. So we're saying to GPs, if someone's coming in with upper respiratory conditions, you should be testing them for both COVID and influenza A at the same time.
Are there state facilities where people can go to do that, or are you subsidising GPs?
Yeah, well, certainly if people are presenting in our EDs with upper respiratory conditions, then we can provide that testing through Pathology Queensland, but there are many private pathologists out there that partner with GPs that people, if they get a referral, will be able to go get those tests as well. Well, we need to move to a business as usual. We have to make decisions. There were very few people turning up to those fever clinics. Most people are going to their GPs now if they're feeling unwell. And if they're extremely unwell, of course, they're presenting at our hospitals. So we do need to move to a business as usual. We also are phasing out those fever clinics because these are health workers. These are frontline health workers. And right now, I need those frontline health workers back in our hospitals. That is the best use of those resources when we know we have private pathologists out there who can do the testing and can be referred by GPs for those tests.
On the Coldrake review, Professor Peter Coldrake told the ABC this morning that those at the top of government have the most responsibility to set the tone of culture in public service. Do you and your fellow cabinet ministers take responsibility for the poor culture in public service?
Well, we take responsibility for the fact that we know that we need to do better, that it was this government and the Premier that initiated this review. We knew that there would be things uncovered in this report. That's why you undertake reviews, that there was going to be recommendations and there would need to be changes. And it should be welcomed that we're a government willing to do that, that we're a government that was willing to put this review out there, to commit to the recommendations, and as the Premier has put out in a statement last night, that we are accepting these lock, stock and barrel. These are significant changes, and this will lead the country in relation to reforms. Everyone should show respect. Public servants should show respect to each other. government members and members of parliament of all sides should show respect to each other and should show respect to the public service.
Minister, it's been nearly 4 years since abortion was decriminalised in Queensland. What do you say to concerns that abortion access has gone backwards in some parts of regional Queensland over the last year?
Look, I'm really concerned that Marie Stopes closed their regional facilities. That was disappointing, but that's a commercial decision for them to make. I'm working with all of our hospital and health services about where we can step in and fill that gap. Is there other private providers that we could partner with? We have, and I was in Townsville yesterday, where $1 million is being committed to termination of pregnancy programs for North Queensland. I know Central Queensland's looking at expanding their programs as well. We know we need to do more. I've met with the stakeholders as well and said, what more can we be doing to support women, because it's not enough just to decriminalise terminations, but we need to support them with the programs. This isn't something that traditionally the public hospitals have done. We have funded other providers to do this, but when the market fails in that regard and there is gaps in these services, I absolutely believe we need to step up and fill those gaps, and that's what I'm asking our HHSs to do at the moment, and that's a body of work they're engaging in right now.
And that can't wait. Should there be more urgency?
Well, I think we should get on with the job. We've done a lot of reviews. We've got a lot of work being done across government, and we engaged Pete Coldrake to do this body of work. I haven't heard any criticism of his report or the capability of him in giving this report. I think we should get on with implementing these recommendations, not use this as a reason to do another inquiry that would lead to further delays. This report does not suggest there needs to be a Royal Commission, doesn't support there's allegations of corruption, like the opposition likes to carry on about. What it says is that there needs to be improvement in culture across the public service and government, and that's governments of all persuasions. And we should all take on board this report and get on with implementing these recommendations, and I know the Premier's committed to bringing this before Cabinet on Monday.
What will you do within your department to make it the right to information process a lot easier? The report highlighted that there's a culture within the public service to shift away information off the public record, which is of concern. What can you do to encourage?
Well, the first thing we should be doing is encouraging all of our Directors General and our senior executives across the public service to read this report thoroughly. Because it's not just about what government and the elected officials of the day should do, but it's all about public service as well and how we can improve culture in the public service. So, I don't decide RTIs. They go to an RTI unit within the department and they decide what gets released and what doesn't, and whether things need to be redacted or not. But they should feel empowered to do that without having any fear or favour. So it is important, and I guess we'll work through these recommendations as to what else we can do, whether it's further training or education or support for those public servants who are making those decisions around RTIs.
Why do they feel like that?
Well, I can't speak for them. It's certainly a decision for the individuals, but there's been a lot of submissions put forward in the Coldrake review that have highlighted this issue, and I think we do need to look at, and the Directors General need to look at, what support, what training do we give to make sure that all of those people in those units who are making those decisions feel like they can do that and do that without any fear or favour. Look, again, Peter Coldrake chose to release the report and make the recommendations he did. My view is this: I've been in politics for almost 15 years as an elected Member of Parliament at federal and state level. Anyone who reads my speeches will see that I make a point of saying that respect should be shown at all levels. Respect should be shown to the elected officials across Parliament, the way we interact with each other. Respect should be shown to public servants because they're there each and every day to make a difference in Queenslanders' lives. They do a very important job, and whether we are talking about any individual or whether we're talking about public servants collectively, we should have nothing but praise for public sector staff as opposed to deriding them. We shouldn't be attacking them publicly, and this is a message to all politicians. We shouldn't be attacking public servants, whether it's behind closed doors or open in the public at press conferences or in the chamber in Parliament. Public servants should be acknowledged for the great work they do. And there should be processes in place to make sure that they're respected and there is a good culture. We are the largest employer across the state, the public service. And of course that means that there will be issues from time to time. But there needs to be a very clear message that bullying or intimidation is not acceptable by anyone at any level.
The report recommends banning lobbyists working as political campaigners. The government has hit having lobbyists work in the 2020 election campaign with a serious misjudgment.
Look, what I will say is the government has accepted the recommendations. The Premier has said she accepts these recommendations. We can be doing better, we will do better, and we will be leading the country in relation to these reforms. Look, we have to work through these recommendations, but the Premier could not be clearer. She accepts these recommendations lock, stock and barrel. Thank you. Thank you.
No worries, just that.
You did a great